Hello, and thank you for joining us today for Surviving Breast Cancer and the Cancer Journey. As a reminder, all lines will be muted and the presentation will also be recorded and provided in a follow-up email. This event is brought to you by the Samaritan Cancer Resource Centers. Our mission is to partner with anyone touched by cancer to provide the support they need to live with strength, determination, and hope into the future. Please submit any questions to the Q&A box. Questions will be monitored throughout the duration of the presentation and will be answered at the end. A link to a post-presentation survey will be provided within the Q&A and chat box. Please take a moment to give us your feedback regarding today's presentation. Today, we are pleased to have Holly Almond and Anne Pettingill as our guests. Holly is an advanced oncology certified nurse practitioner with nearly 30 years of experience working in hematology, oncology, and bone marrow transplant services. She has special interest in cancer survivorship and managing post-treatment side effects. She enjoys helping with community service outreach and spending time with her family. Anne is a 7-year breast cancer survivor who works in the financial industry and lives here in Albany, Oregon. Today we'll be going over Anne's cancer and survivorship story. Holly will be presenting defining cancer survivor and survivorship, as well as reviewing a survivorship care plan, and we'll wrap up today with a Q&A. It is now my pleasure to take the presentation over to Anne.
Thank you so much. I'm excited and honored to be a part of this presentation. I feel that survivorship is so important as you're navigating your journey, so I'm excited to share my story a little bit. If you want to go to the next slide, I wanted to give a little bit of a pictorial depiction of all of my journey up to now. So I'll just ground in. I was diagnosed in April of 2014. I was 36 and a half at the time, had a 3.5-year-old son at home, diagnosed with stage 3 breast cancer, ER/PR negative, HER2 positive. And probably it all starts with, well, how did you know? You were so young. And I found the lump myself and went in and raised it up to my OBGYN and further went in for mammogram and ultrasound and biopsy and was diagnosed. So my treatment plan, right from there started with a port placed, chemo, a left mastectomy, then radiation, followed by a right mastectomy with reconstruction. I did Herceptin for a full year and then went on the oral chemo neratinib for a year. So that is the part of my story that is kind of the train that was given to me, and I was put on the tracks to go through each of these different functions of treatment. And then during that time, I was able to tap into some of the resources, utilize the resource center and just all of the wonderful things that are available. And so I wanted to share kind of my story and how I navigated the journey that I was forced to be placed on, meaning going through treatment, and how I tapped into all the resources. So I, of course, utilized the breast cancer navigator. I utilized social workers to talk about what the diagnosis meant for me, how that would affect my family. I worked full time, was a mother, was a wife, a friend, everything. So navigating what that looked like for my new normal for the period of time that I was going through treatment. And the social workers were huge along with my navigator. Utilized the wigs and the scarves and the caps available as I went through losing my hair and kind of what that was going to look like. A brief funny story about that. When I was diagnosed, I had hair. I didn't put a pre-picture, but I had hair that was down to like my waist. And I thought the one thing I can control right now is cutting my hair. So as soon as I was diagnosed, I cut 2.5 feet of hair off and decided, okay, that's the one thing I can control. Went through chemo, ended up shaving my head. And the next morning I woke up and I had a moment of panic because I realized I didn't know what I was going to wear to work. Like, what was I going to put on my head? And so thankfully I had scarves and caps and those kind of things, but ended up not actually using any wigs because it was the summer and it was super hot when I was going through chemo. And for those of you that may or may not have worn a wig before, it's very hot, and I wasn't about to do that. So also utilized the Cancer Resource Center library to find books that not only helped myself, but helped my son. So being 3.5 and trying to understand all the changes he was going to be going through as part of our family. And then also for my husband as my caretaker, what that looked like for him and how he could also be very much supported in this process. Through the surgeries and everything, I was utilizing the community and all the resources that are there, like using Donna Bella for post-mastectomy care bra, and then the lymphedema sleeve. Obviously utilizing Cindy Davis as a lymphedema specialist. There's massage that was available. I utilized that during my treatment so that I was able to receive some relaxation in the process, and someone that was very aware of what I was going through. Depending on where I was at in my treatment, at the very end, I ended up utilizing the Sam Fit benefit and the trainer that was available to help me build some more strength, because I had the latissimus reconstruction that kind of affected my left side latissimus muscle. So I utilized that resource. Dietitian to just talk about what kind of things I should be cognizant of. Going through chemo, you kind of lose all taste, that I did anyway. And so kind of making sure that I'm still staying healthy and getting good food during that time. And then after the fact, just some smart things as I managed my weight and I managed kind of the most health benefits in the foods I was eating. And what else? Oh, I did interact with the patient finance group when I was navigating the neratinib, which had just come available on the market when I started taking it. So kind of they were helping me navigate that in my insurance, which was a huge help. The last thing I want to mention is just the support group that I attended. We have a group that is called the Young Adult Support Group, and I kind of laugh every time I hear that name because our ages, it's no longer 20 to 40, it's more like 40s to 60s. But the group itself is so impactful. I remember showing up thinking I am not a support group person in any way, but I showed up because I needed to have a connection with other people going through the same things. And the thing that I took away from the most was these are women that were in all stages. So there were people that were also newly diagnosed like I was. And then there was women that just finished treatment. There were women that were years out, many years out. And it was so empowering for me to see women that had survived it, were thriving, connecting with women that were in the middle of it, or even those that have already been through it, just kind of getting tips and tricks and sharing just struggles that I was going through because they could relate so much. And that group has become some of the closest people that I've ever been close to because I'm so connected with them as I went through this journey. And that group is so welcoming to all people. So if you've already had cancer and you just feel like you have some things that are still coming up that you'd like to be able to connect with others on, it was incredible. And then the newly diagnosed, I love when somebody comes into our group who's new and how we quickly are able to support them in whatever they need where they're at. So that's my story. You can see my journey there. I did a photo shoot with a friend of mine who's a photographer when I was bald because I needed something to make I needed something that made me feel like I was a little bit more in control. And so we did a pretty awesome, powerful photo shoot. My little son in that picture when he was kind of just supporting me through that. He's been incredible in that journey. My last chemo is captured there. My infusion nurses were a huge part of my journey and I'm still friends with them. So that was very special. Every year on my cancer anniversary, my survivorship anniversary, I go and bring little tokens of appreciation to my surgeon and my infusion nurses and my doctor. And so that's just kind of my way of giving back. There's a picture of the beaver and I was part of the Damn Cancer event at OSU, and just some other pictures of my family. One thing that I wanted to make sure I depict was when you're going through chemo and everything and you lose your hair, a lot of people struggle with, will it come back? What will it be like? Will it be the same? And I'm thankful to see that my hair did come back. It has grown out, and it's like a new sense of it's a new part of survivorship, I guess I should say, is that, you know, I went through the journey and I have a appreciation for that, but I'm on the other side of it now. So that's my journey. Thank you for listening and being a part of it. And I'm just thankful you all are here.
Thanks so much, Anne. And Anne and I will do a part of this together. And as Annie introduced, I'm Holly Almond, and I'm an oncology nurse practitioner. And just as I know, my patients come into my office as more than just a diagnosis. There's more to me than just my title of nurse practitioner. And I'm a mother and a wife and a daughter and a sister and a friend. And I too have been affected by cancer. I've had 5 family members and 21 coworkers and friends who've been diagnosed with cancer. So my experience, both personally and professionally, has led me to have this interest in cancer survivorship. So the words survivor and survivorship, I think, you know, really, Anne is a testament to what those things mean. And you know, while they may be buzzwords over the last few years, it's interesting, I think, historically to know that they were really first described decades ago when the National Coalition for Cancer Survivorship set out to really establish an organization and wanted to replace the words cancer victim with cancer survivor. And that was in order to bring about a different perspective to that cancer experience. And so you may see very different definitions of survivor, and really it is personal to each person. But in terms of what we think about in the cancer care continuum, a survivor is a cancer patient from the time of their diagnosis and through the end of their life. And it's also more recently been expanded to include family, friends, and caregivers who are often referred to as co-survivors. Survivorship, you know, really became prevalent based on feedback from patients, from oncologists, and from non-oncology providers. It's been deemed a very important part of quality cancer care. In fact, it's been recognized as an integral component of accreditation of comprehensive cancer centers like ours. So the focus of survivorship is really supporting those with a cancer diagnosis to help them live with that diagnosis, to live through it and beyond the cancer. And it's committing to improve care and provide support to patients and those affected by the physical, emotional, social, financial, and even spiritual consequences of having cancer. So survivorship at Samaritan really is a dedication to patients from their diagnosis through coordination of care between specialists like the radiation oncologists, the reconstructive surgeons, the surgical oncologists, the primary care team, and really through providing cutting-edge treatment, providing research, screening opportunities, and a variety of support services that Anne spoke about, and I'll speak about a little bit more. It really is a commitment to offering services that help our patients through their journey. As Anne spoke of, the nurse navigator, the dietitian, social work, support groups, healing arts, our lymphedema, and ongoing education such as these series. So survivorship after treatment is a time that we think about that patients can heal from these physical and emotional effects from treatment. And really, it's often when the real work begins. It's when the appointments become less frequent, and sometimes the enormity of what has just been a patient has gone through starts to be realized. And it always makes me think about my time when I worked at City of Hope, and they had a sculpture when people would drive into the grounds, and it said, There's no profit in curing the body if in the process we destroy the soul. And so I really feel like survivorship is taking care of that soul. Just historically, looking back at what does cancer survivorship mean and putting that into perspective, we know that as of 2019, there's almost 17 million individuals with a history of cancer living in our country. And in Oregon, there's over 200,000 cancer survivors. So those are people that are walking amongst us and that deserve care and support. And so while the cancer survivor and survivorship definition can be different for each person, the intention really is to make sure we're providing the same effort, care, and commitment to our patients through their entire journey. Our survivorship program really does try to combine all the components of cancer care with an emphasis on the time that begins at the end of active treatment. That's surgery, radiation, chemotherapy, NER, and all of those. It's a time to heal from the physical and emotional side effects from diagnosis and treatment. It's a time to learn about ways in which to decrease the risk of recurrence of cancer, the occurrence of other cancers or health problems like heart disease, diabetes. It's also an important time to connect. When patients are going through treatment, they tell me that they've heard about the support services that we have, but don't always have the time or the energy to be able to reach out to those. So after treatment is complete, it's a time to connect with those resources, support groups. Important to connect with others, like Anne said, who have gone through similar experiences. Part of a survivorship program is often having a survivorship care plan. And it really is tying together all the pieces from the beginning of diagnosis. And so, it's a document that's provided to patients, and it really grew out of the need to have a more comprehensive and coordinated follow-up care plan for survivors. It's intended to be delivered at the end of active treatment, such as chemo, radiation, or surgery. And more importantly, it's a communication tool so that patients can go back to their non-oncology providers, and they each know the recommendation for the weeks and the months and the years to come. It's a roadmap. And so, Anne, feel free to jump in here as we go through the survivorship care plan, because you can speak to how these parts were reflective or things that you learned as you went through your journey. And, one of the important things that we think about in terms of communication, it's important to identify who the healthcare providers are, both for the patients and also for the healthcare providers as well, to have easy access to know who was taking care of you, what their role was, and contact information in case you needed to get in touch with them. The next part really starts at the beginning of a patient's story, and that is the cancer diagnosis. And this includes important details that, we don't expect people to be experts on this, but also it's good to have some knowledge about maybe how your treatment was guided and what specific details of your cancer helped make some informed decisions. So this part includes the name and location of your cancer, specific details of your pathology, the stage of your cancer, your date of diagnosis. And I often have patients ask me, what day can I say it's my 1 year, 5 year, 10-year anniversary? And for record keeping purposes, we go from the date that cancer is first put on a person's medical record based on pathology. But I tell people, just pick a date that's meaningful to you. And for some, that's the surgery date where things were removed. And so this is more just for a record keeping purpose.
One thing, Holly, I'll speak to is that it's real important, I feel like, for people to be empowered by knowledge of their diagnosis. So sometimes you get in the mode of just attending all of your appointments and all the treatments and the surgeries and all of the things that you forget or don't understand things about your diagnosis. So I love that you take the time to speak to, this is the type of cancer you had. This is, the exact you know, everything about the diagnosis, the stage, the receptors, all of that, and you educate people so they can understand. Because oftentimes when you're first given that information, it's like drinking out of a fire hose, and you may not even know how those things are going to relate. So I love, as part of the survivorship plan, that you actually break those down and explain all of those things, both at diagnosis and then the long-term effects of that. So I love that about the survivorship plan.
Oh, good. And then that next piece really is going into those details of what surgery someone received. Were their lymph nodes removed, and how many? Was there a second surgery that was needed? Was there radiation? And there's some specific details that get put on here in terms of dosages, which we don't expect people to know, but it's important. You know, for instance, if someone moves away and maybe it's hard to access records, that they have that information. Also chemotherapy, if patients receive chemotherapy, we know that there are certain medications that we give people that can have long-term potential side effects. And some of these chemotherapies, in fact, have a lifetime maximum dose that is recommended, because the risks of certain toxicities like cardiac toxicities can increase if you exceed that dose. So this is something that we keep track of. Also, if somebody started endocrine or hormonal therapy, when was that start date? And really, you know, sometimes because of all the information patients receive, they don't remember how long they're going to be on that. So we talk about what that looks like, and we think about what if they're having side effects, how we get them to that date that we want to get that treatment completed. We also have on here patients participated in clinical trials. We know that oftentimes people think about clinical trials as something that we don't know what else to do, so let's try this experimental drug. And we know that that is not the case any longer always. In fact, we really know that for cancer patients specifically, that we're finding these cancers earlier through detection, and we're having better outcomes because of our advances scientifically. And so we also want to know how are patients doing going forward? How can we, you know, for example, encourage people to make some healthy choices? And we have a partner exercise program right now that, you know, looks at, if you provide people with some access to activity and they have someone to do this with, will that increase their activity level? We also have one about mindfulness and looking at applications for using mindfulness. So it's an opportunity to kind of review what patients have gone through and also think about maybe going forward. For instance, we have some patients who have hereditary cancer syndromes, and there's some trials that gather data while patients are on there. So, and then also importantly, we know when we are seeing patients as they go through treatment, we're very focused on, you know, what's the next task at hand? Is it another cycle of chemo? And so oftentimes when that treatment has completed, here is this time going forward, and we really need to know what kind of ongoing side effects are you having from chemo? And patients, you know, you need to know, is this a usual side effect? How long can this, you know, is this symptom expected to last? Could this be permanent? And more importantly, how can we alleviate these symptoms? Is it through a referral to lymphedema? Is it by addressing and discussing what peripheral neuropathy means? Is it finding a way to work with hot flashes? Is it getting you to physical therapy to help with deconditioning? And the next part is going through that journey forward, that roadmap, a follow-up plan. So talking about those treatments a little more in depth if you are to be on some ongoing treatment for 5 to 10 years. And then knowing, instead of saying, you know, we'll see you in 3 months, it's looking at, you know, what are the appointment recommendations? We know that just like we have recommendations for treatment, we have national guidelines that make recommendations to how often patients should be seen. For example, 6 months for 5 years, and then yearly after that. Who else should be involved in the care? What's considered a surveillance visit? And oftentimes it's incorporating more than the oncologist. It could be the gynecologist, the surgeon, and so important to delineate that. We then want to make sure that patients know that the recommendations are set for who should order what and what frequency something should be ordered. For example, if patients still have their breasts, a mammogram, the recommendations for that, that if they're on specific endocrine therapies, there's some imaging that maybe needs to be ordered periodically to assess their bone density. If patients have had reconstructive surgery and have implants, there's some recommendations to imaging of that, not necessarily to screen for cancer recurrences, but to really look at the integrity of those implants. And so we want to make sure that it's very clear for patients to know who they're going to be seeing, what test is going to be ordered, and at what frequency. And also assigning homework, not forgetting that as patients, there's homework as well, and that is, you know, doing a self chest exam, armpit exam, breast exam, looking for any changes. And not necessarily are those changes always related to a cancer recurrence, but maybe some side effects such as scar tissue or lymphedema. In addition to that, we want to take the opportunity to make sure we're working well with the primary care providers. They receive this document also, and it helps them see the things that we'll be ordering, and also gives them, what our expectation for them is as well. And, we want to make sure that we're helping people and educating people and connecting them with resources that maybe they didn't realize they needed to have done or had difficulty accessing. And so we think about other cancer screening and how important that is. And those are things like colon cancer screening, cervical cancer screening, lung cancer screening, and skin cancer screening. We want to always, when we see patients, part of the conversation and all of the follow-up visits that we have are making sure that we're thinking about the treatments that occurred prior to that visit. And sometimes that's months later, and sometimes that's years later, and thinking about those late effects that can happen. Lymphedema can be a lifelong risk. Patients can have ongoing issues related to certain treatments or new issues, including things like increased risk for osteoporosis, early menopause. Surgery can be associated with lymphedema, with numbness or weakness. And more importantly, we want patients to know that while there may not be a specific symptom that we can say, look for X, Y, and Z, it's important to know that, let us know if you have a concern about any symptom you may have. So oftentimes we tell patients, it could be a cough or shortness of breath or bone pain or headache, but make sure that if you have a symptom that is new or persistent or something that you're worried about, please call us. We know that patients sometimes think they need to wait for their appointments to bring those up, but we want people to know that they can contact us at any time should they have a concern. And Anne, I know you had some specific great feedback regarding this section.
Yeah, when you're on the side of finishing all of your treatments, things slow down from a appointment standpoint, and then you get into this mode of relief of being done with treatments, but also a slight panic because now you don't feel like you're doing something necessarily super actively like you were used to. So I always just share with people something that my oncologist and I discussed, and that was something that we were going to, if any symptom came up, instead of feeling anxiety or panic about it, I just stayed very present and aware of that symptom. And if it persisted more than 3 weeks, then it was a good indicator that I can reach out. And for me, personally, that was a good mental threshold that allows me to kind of be in control of my body and stay very aware of my body. So now, if anything happens, if I have a headache, if my leg hurts, I feel like I'm having some shortness of breath, I always kind of sit it out and just kind of watch it. And if it doesn't resolve in 3 weeks, then I kind of lead up on that. And for me, that was a good parameter just so that I was able to kind of navigate what my life was going to be like. And I love that you brought up like lymphedema and those sort of things, because that is, if you had lymph involvement, that is, lifelong, and that can happen at any time. It can be affected based on, any sort of thing that could happen to perhaps that limb or something like that. So education on what resources are available. So, we've had many people in my group that, maybe they had some sort of injury to the side where the breast cancer was and the lymph involvement was, and they ended up having to go into the lymphedema specialist, and that's years out. So just being very aware of who the resources are and things that you need to, be prepared for if they should happen. And then also just basic awareness on, how to take care of your body and things you might notice as you go out because of the delayed effects that happen from treatment. So yeah, I love that there's kind of a parameter set if symptoms should come up, and they're not everything, is totally concerning. Sometimes it's just a matter of, seeing if maybe you just didn't drink enough water, or maybe you walked funny or something and your leg hurts, whatever it is, just being aware of the symptom and then how long it lasts, and then leading up when you feel it should be necessary.
And you touch on something so important, that communication piece is just crucial, and having that two-way discussion with your provider about, how can we set some parameters, and really that education. I think our surgeons are so proactive that they, make sure that the lymphedema therapists are involved early on, and it's not waiting for a problem to occur. It's being proactive and providing that education. And so as you move down this road, it's not a surprise or a shock, or because that can certainly raise some fear if this is something that you weren't aware of that could happen. And, when we talk about, lymphedema and, all of those components that you tapped into, and during your journey, and we know that cancer can have these emotional, physical, and financial effects on people and families. And so oftentimes things are kind of compartmentalized, just get to the next stage of getting rid of this cancer. And so when treatment is done, or things are on more of a maintenance time, this is a great time not to forget about the resources that are available. And those are ongoing for our community, for our patients. And those are things that, are the physical therapy and the lymphedema therapist, getting access to a genetics counselor, speaking with a dietitian, thinking about research, and most importantly, thinking about this road forward and asking for help that you need. When we think about the cancer that we're discussing, we also need to think about, are there risk factors? Is there something that we can do to be a little bit more proactive in terms of the way that we do surveillance for our patients, or think about the other family members? We know that it's only about 5 to 10% of cancers that can be from a hereditary cancer syndrome. But it's important to identify those red flags, and it's important for patients to make a list of all the cancers in their family, and if you feel comfortable discussing your cancer diagnosis with family members, so that can be reported to their and your providers, because perhaps a referral to a genetics counselor to do a deeper dive and see if there's recommendations that need to be made for testing. We think about, the risk assessment, and are there ways in which we can reduce risks that we can control? So the hereditary cancer syndromes we can't control, but things like lifestyle behaviors like alcohol use and smoking, which can increase the risk of cancer. So we want to make sure that we're providing ongoing education and identification of issues that maybe patients need support with to move forward in a healthy way, much like they did with their getting their cancer treated. And so, part of this whole survivorship journey is making sure that we're empowering patients with education and support. And it really is more than just that piece of where that cancer was and that diagnosis. And it's looking at things like prevention. What things can we do? Well, we know that patients who are consistent with their primary care providers are staying up on things that can increase your risk for health problems. We know that, safe behaviors out, like using sunscreen and avoiding tanning beds and wearing seat belts are important. Nutrition is so important. Food is medicine, and we know that for patients, it's important to make sure that they know resources that can help them identify access to food if there's some inability to get good food for your home and your family. But we also know that we can't assume that everyone understands which are the important foods to eat. And, really it's about thinking about those whole grains, thinking about limiting processed foods, making sure that we're getting in fruits and vegetables a day. We know that we are so fortunate to live where we live, and we know where our food sources come from. So we talk about nutrition as it relates to decreasing cancer risk, but also increasing overall health. And reminders that, exercise is an important and active role that patients can take in reducing the risk of cancer recurrence. And we know that those people who exercise at least 150 minutes a week have decreased risks of heart disease, cancer recurrences. So we know that especially after treatment, patients they have a lot of debilitation going on. And so we know that it's just starting slow and moving forward. And so one of our survivors at her 5-year cancer anniversary really, recognized the importance of activity, and so worked with us to help get the SAM Fit for Survivor program and set some programs up so patients have access to a fitness facility and a trainer to help them. We know that the emotional and mental effects of chemotherapy and treatment and cancer can really play a big impact on how people recover. And it's very common for people after treatment, months or a year down the line, to all of a sudden feel the enormity of what they went through. And these are normal feelings, to feel fear and grief and anger. But if perhaps those start to interfere with sleep or relationships, that patients know that we're here to help them get connected with resources. Anne talked about the support group, and oftentimes, patients need to be and hear stories from those who've gone through something similar. And so nothing can replace that, like being around somebody who's walked that same or similar journey. And so in addition to support groups, there's things that we know that are important, like taking care of our mental health, and also bringing some peace back into our lives. And that can be done through taking time for things like yoga or meditation relaxation, and just being present. You know, I think my patients always tell me that it's just they're thinking about the treatment they just had and then what's to come, either the scan, and just a reminder to try and help people get connected with things that will allow them to be just present where they are and thankful for what their body has done and the journey that they've been on.
One thing, Holly, that I also mentioned that I didn't mention before is there's been some really unique opportunities through Samaritan, through the arts care program and the arts program that they offer. Prior to COVID, there was the monthly arts care where people, survivors and caregivers could join together to create things if you are a creative being. And then there's also the other art program. I know there's a grant, the art program through the U of O that they were also hosting, and that's been really kind of cool. I'm not an artist by any means, but it was really exciting to participate in something creative, and whether it's whatever the medium is, but being able to do it and be with others that have gone through the same experiences and just kind of talking about our journey as we do something creative. And sometimes like I said, our families could be involved with COVID and everyone being virtual. It was really unique to have them participate also. So just kind of as we think about general wellness, that's a great benefit that Samaritan was offering or is offering currently, and I've enjoyed that.
Yeah, I love that. And I think about how we don't always have to recreate the wheel. We need to know where our resources are and make these connections, because our communities, you know, sometimes are, you know, doing similar things, but really can benefit on joining together and providing unique opportunities for our patients. So the arts care program, and through the Jordan Schnitzer Museum, the Art Heals program, through the Arts and Healthcare program have been really great additions to, you know, really that recovery process and processing for our patients. And then thinking about, you know, the relationships that get affected, you know, our intimate relationships with both ourselves and our partners. You know, those are things that we have the pelvic floor therapists. The Resource Center has put together some groups that talk about opening those conversations after chemotherapy and the effects it can have on our intimacy. And then, you know, again, trying to make sure that patients know that it's not just here in Corvallis, that we have all these resources that we want to extend to all of our patients in Albany, Lebanon, Lincoln City, Newport, and, you know, COVID and with the Teams and Zoom has really allowed us to even do more of that and find unique ways to reach people. You know, I think with the support groups, I've had patients who felt uncomfortable being in person prior to COVID, and having the opportunity to do these things online has kind of given them some support and comfort and maybe some confidence to maybe go into those groups when things open up a bit. There's just some additional resources. So, you know, our survivorship care plan is really, you know, your story. It's like I said, a record-keeping communication tool for a patient and their healthcare team. And as you can tell, it combined all the necessary information that patients receive through their journey, and it keeps people on the same page. Like I said, it's a roadmap and identifies who's responsible for ordering what test and when, so that there's no guesswork. We know that it's so important to move forward by addressing any ongoing symptoms or side effects or concern, and connecting patients with resources. You know, and just as we celebrate our survivors' journeys, we also, you know, work to make sure that the journeys are the best that they can be. And so we do this by working with the healthcare team, the primary care, dermatology, GI, all of those other people who touch our patients' lives. And like I said, you know, we have these big and small communities, and we want to make sure that they're available to everyone, both during and after treatment. And most importantly, we don't want people to feel like they're alone in this journey. And there's so much to celebrate, and but I also want to take a moment to think about those who aren't here. And when we talk about survivors and those who aren't here, it's not as my friend Susan told me. She said, whenever you talk about cancer survivors that aren't here, like her now, she said, make sure people know it wasn't because we lost the battle and weren't surviving. It really, like for her, told me she stopped giving cancer a free ride. And so, really, survivorship is the focus on helping people to survive and live well. When we think about the cancer experience and the cancer diagnosis, it is more about than just surviving. It's about this living well.
Thank you so much, Holly, for your expertise, and Anne, thank you for sharing your personal journey and experience with survivorship. We really appreciate hearing from the patient's perspective on this topic, and it was very impactful, so thank you. I'd like to take a couple of moments to go over some information to give you guys a few minutes to write in all of your questions. If you'd like to obtain more information and resources about cancer, please feel free to contact us at the Cancer Resource Centers by phone, email, or by visiting our website. The Cancer Resource Centers provide a monthly virtual education event or events on different cancer-related topics. And if you're interested in any of our upcoming events or just what's going on, please contact us to subscribe to our Cancer Resource Center newsletter. And our email is listed above at cancerresourcecenter@samhealth.org. And our next webinar in our Healthy Minds and Healthy Bodies virtual education series will be lymphedema, understanding the basics of this condition, with our lymphedema specialist, Cindy Davis. This is going to occur on Wednesday, November 10th. So if you're interested in joining us for this event or any upcoming Healthy Minds, Healthy Bodies seminars, please visit us at samhealth.org/behealthy, or contact us through the email or just by swinging by one of the resource centers. We'd be happy to speak with you. All right, so hopefully we have some good questions waiting for us. I'm going to turn the Q&A over to Christina. Please let us know what you think.
Good afternoon. Thank you, Holly, and thank you, Anne. Those were both, Anne, thank you for your story. That was great. And Holly, for your wonderful information. We do have a couple questions. One says, what should one do if she never received a care plan? Too many oncologists have left. Perhaps I fell through the cracks.
That's a great question. And when we think about how survivorship and the care plan was implemented, it really was that identification of it being an important part of cancer care. And so through our accreditation through the Commission on Cancer and the NAPBC, they give us some specific requirements of identifying our group of patients who we will deliver care plans for to show that we're meeting that standard. And so right now and over the past couple of years, it has been patients who have been through stage 3 and treated with their first line of treatment with curative intent. And so, like as you've said, we've had a lot of change and turnover, and so that's left fewer people to deliver the care plans. And so as our program has built back up again with Samaritan and the work of Oregon Oncology specialists, we hope to get more of those care plans delivered to patients. And Anne is going to help me put a link in the email that you guys are going to receive with some samples of care plans. One of the great things about the electronic record and my chart are that information is now more accessible to patients. And I was a part of one group where patients downloaded the care plans and were able to fill out the information based on their the information they could get from their chart. And then just talking with your oncology provider about getting arrangements to make a visit for survivorship when things are kind of up and going. But really, I think it's about getting immediate access to that care plan, so we'll provide a link.
Okay, and I think that you may have answered that in your answer right now, but we have another question that says, how does one access this document? Who fills it out, and is it online?
Yeah, and we will, like I said, put that link, you're right. And it's a very fluid document. You know, I have a nurse that helps me fill this out, and it actually gets delivered. We have a wonderful nurse and our head and neck navigator that delivers them in radiation oncology. The urology office hands them out as well. So there's different places throughout Samaritan that patient can get them, but downloading that document, filling out the pieces that you can on your own, and then having that discussion with your provider, your provider's nurse to get you the information that you need to help fill that out.
Great, thank you. Looks like we have one last question. It says, it sounds like a survivor plan is not the same as a care plan. If one never received a survivor plan, what should one do?
And so the survivorship care plan is really a combination of a treatment summary and a follow-up plan. And so the names are kind of interchangeable. And so again, I think having access to the document through the link will be the best way to receive it and to fill that out. So the care plan, it's often been called a care plan, a treatment summary, a roadmap, but it really is the information that you get from the start of your treatment and a roadmap for the journey forward.
Okay, thank you for answering those questions. It doesn't look like we have any more questions as of right now.
All right, thank you, Christina.
Yeah.
Thank you, everyone that attended today. Your feedback is valued, and if you could please take a moment to complete the brief survey, which is available in the chat area, that would be very helpful for us. Please watch for a follow-up email that will include a link to the recording of today's presentation. And again, thank you so much for joining us. I hope you all have a wonderful day.